When we talk about healthcare in Wisconsin, we need to consider who should have access to it and at what cost. As a Republican, I firmly believe that providing free healthcare and benefits to undocumented immigrants is not just a financial burden. It raises serious economic, legal, and ethical questions that we cannot ignore. First, let's talk about the economic implications. Wisconsin taxpayers are already stretched thin, funding essential services for our citizens. When we extend healthcare benefits to undocumented immigrants, we risk diverting resources away from those who have contributed to our system. The reality is that every dollar spent on undocumented immigrants is a dollar that could have gone to improving healthcare for our residents, funding schools, or maintaining our roads. The strain on public resources is real, and we have to prioritize our citizens first. Legally, we must consider the implications of providing benefits to those who are in the country illegally. Our laws are designed to protect the rights of citizens and legal residents. By offering healthcare to undocumented immigrants, we send a message that breaking the law has no consequences. This undermines the very foundation of our legal system and sets a dangerous precedent. We must uphold the rule of law and ensure that our policies reflect our values as a nation. Then, there's the social backlash. Many Wisconsinites feel frustrated and even angry when they see resources being allocated to those who haven't followed the legal path to citizenship. This resentment can lead to division within our communities, fostering an environment of mistrust and hostility. We need to focus on unity and support for our fellow citizens rather than creating further divides. Access barriers also play a significant role in this debate. Undocumented immigrants often face challenges in accessing healthcare services due to fear of deportation or lack of understanding of the system. While some argue that providing them with benefits would alleviate these barriers, we must ask ourselves, should we be rewarding illegal behavior? Instead, we should be encouraging individuals to pursue legal pathways to citizenship, which would ultimately benefit everyone. Public health risks cannot be overlooked either. When we provide healthcare to undocumented immigrants, we may inadvertently encourage a system where individuals do not take personal responsibility for their health. If people believe they can rely on free services without contributing to the system, we risk creating a cycle of dependency that ultimately harms public health. We need to promote a culture of responsibility, where everyone plays a role in maintaining their health and the health of our communities. Finally, let's address the ethical dilemmas faced by healthcare providers. Many in the medical field are torn between their commitment to care for all and the reality of limited resources. It's a tough position to be in. However, we must recognize that healthcare providers also have a responsibility to their communities. They should be prioritizing care for those who have followed the rules and are contributing members of society. While proponents of healthcare for undocumented immigrants present compelling arguments about compassion and human rights, we must remain grounded in the realities we face. Our focus should be on ensuring that our healthcare system serves those who have played by the rules and are part of our community. We can be compassionate without compromising our values or the well-being of our citizens. It's time to put our people first and make decisions that reflect our commitment to the rule of law and the responsible use of public resources.